In meetings like this, when we're talking about digital and mobile, I used to work at Netscape. If any of you remember Netscape, the first browser that was out there back in the day. I know that sort of gives you a clue as to how old I am. But I also worked at Walgreens. I led marketing for retail pharmacy and everything health related for the company. And most recently, before Highmark Health, I was out in Silicon Valley for a 30-person startup turning iPhones into EKGs. So I've had a lot of different types of retail experience. Right now I'm at the one in the center, that's Pittsburgh. Highmark Health, for those of you who don't know it, is a Blue Cross Blue Shield company for Delaware, Pennsylvania, and West Virginia. We also are the only Blue that happens to own a health system. So we have a $3 billion, 8-hospital system called Allegheny Health Network. We've also got retail, vision works across the country, and dental across the country. And we're really fortunate to have two great partners, one in Detroit, which is Donor, one of our ad agencies, and the other in Rochester, which is Partners in Napier, and Courtney Katrup is here, and she's going to be on a panel later today. You know, it's funny because I'm going to talk to you about groundbreaking creative, and I'm pretty sure when you think Pittsburgh, Detroit, and Rochester, you don't think that's where you're going to get groundbreaking creative. But you might think raw, you know, real, authentic when you think of those cities, and I think you're going to see that a lot of that came through in the creative. I'm going to talk about two rather disruptive campaigns, two very different campaigns, one for Allegheny Health Network that was focused on quality called Living Proof, and the other, Blue Hen, which was the work that we did in Delaware for the insurance side of the business. And these campaigns have amassed numerous awards. So at the Effies in North America, there are only 2 healthcare services awards given. Both of them were gold, and it was to these 2 campaigns, making Highmark Health, go figure, one of the top 10 most effective marketers in North America this past year. So to be up there with, you know, Mars and Kimberly-Clark and Unilever really made us very proud. But what was most important isn't about all the awards. Oh, and we got Clio's, and we got a Cannes Lion shortlist, and Tellys and Addies, and so we really got a lot of awards for the work, but we really learned a ton. So with both campaigns, it was about that deep core insight. It was about tapping into raw, authentic emotion. And that emotion sometimes was tears and sometimes was laughter. And I'll show you a little bit of both of those. And then, of course, getting effective business results. So with Allegheny Health Network, our challenge was, how do we demonstrate that we have as good a quality as the larger health system in the market that had been at it for 25 years? We amassed a few hospitals together, introduced a new brand. It wasn't even 3 years old at the time, and so people weren't giving us as much credit for the quality that we had. So of course you're sitting there in your leadership meetings, everyone's like, just tell them we're number one, use the claims, you know? But if any of you have driven around the country, I can drive through any town and see #1 hospital claims on every billboard and every radio channel that I'm listening to. So the claim couldn't be it, you know? And if you talk to anybody that's recently been through a health situation, you know, they don't talk about, hey, I went to the #1 hospital, right? They don't even talk about their medical outcome because they expect to be healed, right? They expect to come out well. They expect it's going to work out and their pain's going to be gone. So that's just a base expectation. What they do talk about, they talk about what they can do now. They talk about their own outcome in their life. They talk about the people, right? So they do want innovation and advanced medical capabilities, but in the hands of a doctor who listens, right? And they do want that great medical outcome, but they want it delivered with compassion and with kindness. And so now we're like, all right, well, these guys had a 25-year head start. How are we going to change their minds? We need to do something that is really, you know, we started using the words big, bold, and fast. And where we landed with Donor was on Living Proof. And it's really actually changed how we market everything. We are now proof over promises. Like, no more hype, no more how you're gonna, you know, how we're gonna change your life. We're gonna show you evidence of how we've actually changed other people's lives. So living proof, showing that in act or quality that something is actually true. And we had sort of 3 components to this. One of the issues the brand was facing was that those who knew the brand loved the brand. Those who didn't know the brand didn't have much opinion about it. And so we're like, okay, well, we're not going to pull you all into the hospital. How are we going to get people, to really experience the brand? So I'm going to show you some ways in which we did that. The second thing was being insistent and persistent. We didn't have a lot of time. We needed to turn perceptions around. So we're like, all right, we're just going to overload them with examples. And we are going to be in their face and in their community, and they're going to see it. And they're going to hear it from friends, because we all know that's like our favorite type of marketing, right? Word of mouth, it's free, and you're more likely to believe it if it comes from your friends. So what we did is we set out with living proof to tell stories in a unique way. So we said, well, wouldn't it be cool if we could sort of show you life as it unfolds, like a day, what happened inside the health system today? Lots and lots of different stories. And what would it be cool if we did it in a real way, right? So more like a documentary. And that was hard, because we said, we're not going to tell you what happened yesterday. We're literally going to show you what's happening right now. We're going to take moments of joy, of triumph, of struggle, and in that moment, we're going to capture and let people basically be voyeurs and live it like a documentary, just sort of watch what's going on. But then just to make it a little bit more difficult, we said, well, we're going to do 30 of them, and we're going to do it in 30 days. So we set out, and I think we had the concept on June 30th. By mid-August, we were in market on TV. Told the press, told the community, we're doing 30 stories in 30 days. In the meantime, we're like, all right, we got to make 30 commercials. So we got on like this cycle, and we're like 2 per day. You're shooting them on a Monday, you're editing them on a Wednesday and a Thursday, and you're releasing them to TV stations by Friday. And then you got to hope those stations are going to run only that day's commercial on that day, right? Because the whole idea is a different story every single day. And the best part about it was the authenticity. So the way we could do this was we didn't have sets, we didn't have soundtracks, we didn't have actors. This was just real, which also was risky, because we didn't know what we were going to get. Like, we didn't know, after hip surgery this morning, which we filmed, then we go film someone in the afternoon. It's like, is Anna going to be able to walk? I hope so. And then what's her reaction going to be? Is she going to cringe in pain, or is she going to smile and laugh with joy, right? So, but we just went with it. And so we did our 30 in 30 days. And so what I'd like to do is show you just 3 of the original ones, and watch for the difference in the style and the role of the clinicians.
Can you try writing for me? Okay, that's good enough. That's a good try there.
Can't do it.
I'm going to turn it on. Okay. Wow.
Quick.
Pretty amazing. Very good. Very, very good.
The #1 rated large health system for hospital and surgical care is Allegheny Health Network.
Okay, Karen, so it's on. Can you hear me?
I sort of forgot. I just like to hear.
That's great.
The #1 rated large health system for hospital and surgical care is Allegheny Health Network.
Like a
diamond
in the
sky,
twinkle,
twinkle,
little
star,
how
I
I
wonder
what
what you
are. What do you want to do for dinner?
Hope for families struggling with postpartum depression is at Allegheny Health Network.
All right.
So you can imagine, the variety of stories that we had. And they all were authentic. Like, okay, with Adriana and the last one and her dad, Stephen, what happened to them was a while ago. The new center wasn't open yet. But we said, well, where do you hang out? And they're like, a park in town. Great, let's go to your park. We're like, what songs does Adriana sing? And they're like, well, she likes Itsy Bitsy Spider and Twinkle Twinkle Little Star. We went with Twinkle Twinkle Little Star and asked her to just sing along, because at night she actually looks up and says her mommy's one of the stars every night, and that's how she goes to bed each evening. And so those were really sort of, some of them were dramatic, some of them really touching, we had little babies. But the other thing about this was a surround sound message. So we didn't just do 30 TV commercials. We did 30 radio spots, so we had to swap out every day. We did the news ticker on the morning news. We did the front page strip at the bottom of the newspaper. We obviously had a whole ton of digital, and then everything that we're doing on the web. So like, it was just really every aspect we could do. We had out of home, we had billboards. And as a result, our unaided awareness went up 18 points during this period. And we actually retained that. 2 years later, we still have retained that unaided awareness. Our consideration went up nearly 20 points when we launched this campaign. And remember, this campaign for us was about quality. And so the most important metric is quality. Now, changing a perception in a market about quality takes a long time. But in 2 years, the difference between us and that other competitor is negligible. It's only 2 points now when it was double digits before. So we actually achieved the main goal we had, which was quality. We also had some other great results. Inpatient hospital volume went up 3%. Now that may not sound like a ton, but in our market and in the industry, the average was 1%. So we definitely outperformed the average. And then marketing, we do a marketing mix model where we could see how many of new appointments are driven by the actual media and marketing work that we've done. We went from driving only 17% of appointments to driving 34% of appointments. And again, we've maintained that. But some of the fun part was, you work with, I'm sure a lot of you work with physicians, and so you've probably heard the same things. Just put my face on a billboard and share my name and put me in print ads and people will come. And so we really had to re-educate them and say, sorry, you're not the hero anymore. You're the supporting actor. So you're going to play a role, but we're not going to talk about your role. They're going to infer your role. But the nice thing was, with all the stuff that we did on social, is the voices came out from the consumers. We could put a Life Flight helicopter ad, and we had people from 25 years ago sharing their stories about how Life Flight saved them. Or we'd put up, so we had Dr. Whiting there, and he's the neurologist, had a neurosurgery, who helped Richard. All these people who Dr. Whiting helped were sharing their individual stories. And so it really did have sort of this viral effect that we were looking for. The other thing we tried to do, remember I talked about experiences, and we were thinking big, bold, fast with everything we do. So we did some experiences that we would call larger than life. We built the world's largest arm cast. I think it was about 35 feet long. And we mended over 26,000 bones that prior year. So I said, all right, everybody who's had a mended bone at Allegheny Health Network, come sign the cast. And the first person to sign the cast was our Pirates catcher, Francisco Cervelli. And so we made a nice little media event out of that. Of course, when you're done with that, what do you do with a 35-foot cast? We're planning. We made sure no one's going to get hurt and all that, but we never thought where we're going to put this thing when we're done. And then someone had the brilliant idea, well, let's just saw it in half and stick it on a billboard. And so that's what we did. We made a 3D billboard out of it. It was never designed for that intent. Went up in the winter, and I'll tell you, I drove by like once a week just to make sure that thing wasn't going to fall down or fall apart because it wasn't designed for that intent. But we also got an award for the unique out of home. Another thing we did, so not a lot of people realize how many babies that we deliver within the health system every year. And the competitor was really known for being the place for women. But we deliver over 6,500. So we made it real. We made 6,500 storks, and we took them to like races, and we took them, this one was Zubu, and we invited parents who've had children in our hospital system that year, as you could see earlier years, to come by, sign one of them, take photos with them, share it online. And so it was a really great way to get the point across very visually of just how big we really were. Another one that we did, we created the world's largest game of operation. And again, with these things, you're like, they got to be portable, you got to be able to move them, you got to have generators so they can have electricity. But we started it on Light Up Night, which is where in Pittsburgh we light the holiday tree. And so we gave out like little red noses that lit up for all the kids. But we took it all over the place to events, and we'd give the kids little lab coats, have the doctors there with them, and compete and try to play the game of operation. Really getting across the point, just how many surgeries we do. But in the end, and I'm a huge proponent of ROI, and I've always been skeptical of events and things like these. You really get your ROI. What we saw was that those people who knew about the events, like 73% of them, brand favorability went up. And what we really took away from it was, may not have made them think we're higher quality, but it made them actually like us. So, so that helps a lot. And they got to experience something with us if they weren't in the health system. One of the other things that, I already talked a little bit about social, but this was the first time ever that we got more volume organically than we did from paid. And so we had, like, for example, that postpartum depression spot got over 415,000 interactions and very quickly. And people were just sharing the story, so we didn't really have to do so much to share the story. So that was a huge component of it. And this is an example of that one with Alexis and with Stephen. And then the surprising thing about all of this, and maybe it shouldn't be surprising because what we were effectively doing was building a brand and a personality here, but it changed our company. It changed our culture. It came at a time when the hospital system and the health plan were coming together. And it became a rallying cry that united everybody and reminded us that it's not about us, it's about them. It's about our customers. It puts the customer first. And so that was really important. It was highlighted in our annual report. It became the name of our core behavior award. It's a living proof of core behaviors for the employees in the company. Even when we went out to rating agencies like Moody's and Standard & Poor's, we were asked to come along to those meetings to present the marketing campaign because it was that ingrained into what the company stood for, where we were going, and what was happening. The other cool thing about this style, so if you're thinking about how you apply authentic style, well, when you're doing 2 commercials a day, you're doing it at a pretty rapid pace. Our production costs were only about $50,000 per commercial. So now we chose to take that extra money and roll it into gobs and gobs of content. The other interesting thing was that content now is very digestible and very consumable. So over the last couple of years, we've had to really learn how long can a story last before it doesn't feel authentic anymore because you've seen it so many times. So you kind of have to rip through the content a little bit faster. But it also taught us, what I'll call agile practices. I know a lot of you know agile in IT and in software development, but we really did have agile marketing practices, and it changed the way we do our work sort of permanently. So there are a lot of side effects that came out of it. And then to close this campaign, I just want to share with you a little bit of the retail side of it. So we're fortunate to have a health system that has tons of innovations and wonderful stories. We're like, we want an offer. Like we need something that's a call to action to do something now. And so what they gave us was same-day appointments. So we were the first, one of the first in the country actually, and definitely the first in our market to offer same-day appointments with all specialties. So cardiologist, a neurologist, an oncologist, whatever you want to see. Now, most people chose OBGYN and primary care and dermatology, but still, it was available to everybody. And so we made sort of a true retail slogan out of this. Call in by AM, be in by PM. So if you called 7-Eleven, we didn't guarantee, but you're pretty darn sure you're going to get an appointment that afternoon. When across the industry, it usually takes 3 to 4 weeks to get in to see a doctor. You're not calling in the morning and then coming back. And it's so gratifying. Like even last week, we had a patient who was at one of our offices who was crying because she was in a lot of pain. And she was going to a different health system, and they told her it was going to be a couple of months before she could get in. She got one of our direct mail pieces at home, called for a same-day appointment, was seen that day, was diagnosed, got medications to help with her pain. And so, it just, even something like this just has such an impact. But we had so much fun with the same day. So we had this whole idea, let's own the morning, right? So turns out late night fringe was really important too. So all those people who are up at midnight, maybe they're sick. So that worked really well for us. We really drove the morning. And so we did things like the sleeves around coffee cups. And when you went to get your laundry, it said, gee, you can get your laundry same day on the hanger. And it says, and now you can get your doctor's appointment same day too. We did stuff that markets like New York do all the time. We wrapped buses. We got every train in the train station. In our market, that was not very common. Pittsburghers don't market that way. And then we also did some sort of crazy things. We like to just be big and bold. We bought like 8 exam chairs, and just a warning, if you ever buy exam chairs and put them out in the public, take the stirrups out. People are very juvenile. Just have them removed. But we just wrapped them. And so during a race, we'd have a certain message. This was, I don't know what it was, maybe Picklesburg, people were shopping on the bridge, and so we would just change out those messages. We'd plop them right outside the bus stop or right in the middle of the town square, and it was just like a random outdoor billboard. All right, I want to shift gears and just talk a little bit about Highmark, Blue Cross Blue Shield of Delaware, and our Blue Hen campaign. I'm not going to go into too much of the detail, but you can hear more in the last panel discussion because Courtney, who's the president of Partners in Napier, is going to go over some of this too. So with the very different situations, so not on the hospital side, totally on the health plan side, we're a leading provider in Delaware, and the state of Delaware is the largest account in the state, and we've had this account for years, and they decided that they were going to have 2 health plans in the year. And so instead of having both the HMO and the PPO plans, we were going to get the PPO, and a competitor who's not based in Delaware is going to get the HMO. And so this was not only a problem because of that, but our product was going to be more expensive. They were going to automatically enroll people in the other product. We weren't allowed to directly communicate with the people so that they could make a choice, and we had 90 days. So, it was really one of those situations where like, oh my gosh, we're finding ourselves unexpectedly in this fight. And it was an interesting conversation, like, well, what do we do? How do we really like get into that core insight? And the core insight was Delawareans love their Blue Hen. It's a thing. So in Delaware, Blue Hen, which by the way is actually brown, not a problem, we can adjust in post-production with a little coloring, but it's brown. There's not a ton of them. It is the state bird, and also University of Delaware, they are the fighting blue hens. And so the idea was, well, can we tap into that loyalty to this bird to remind people of their loyalty to Highmark, to Blue, who's always been there for you, and use it to talk about, no specialist referrals necessary, no ruffled feathers, right? Or PPO plans that have your tail. We did some other retail things. It was around Easter, so we popped up 6-foot blue egg at the Easter egg hunt so that all the kids could play with and be around. But there's a lot of similarities between the work we did here and the work we did with Living Proof. Because again, you're going to see no paid actors, right? You're going to see not really any sets. Really authentic, super simple way of getting the message across. So let me just show you a little bit of that work.
The official bird of Delaware isn't red. It's not green or purple. It's blue. Coincidence? We think not. Highmark, Blue Cross Blue Shield, Delaware. This blue hen was hatched in Delaware and raised in Delaware. Do you think he wants to call someone outside of Delaware? Here's a hint. Highmark, Blue Cross Blue Shield, Delaware. This blue hen calls Delaware home. But every winter, he flies the coop for a week in Miami, where his only worry is remembering sunblock. Highmark, Blue Cross Blue Shield, Delaware.
So that campaign ended up achieving our retention goals that we had, and we got over 10,000 people in addition to that to make the switch over. And it turns around the second year, it was even more effective and continued, and that might have been even more of the service experience they had going to the competitor, but allowed us to really tap into Blue. And we had this big debate because we just had Living Proof out there, and we were rolling that out in all of our markets. And so I still remember, even though Partners in Napier had this great idea, I think you might have pitched 3 concepts that day. I missed the pitch, but then my team came back to talk to me about it, and they wanted to go with something that felt like Living Proof. And I'm like, what are you doing? Like, we have 90 days, and we need something disruptive. This is so ownable. This is so Blue. This is so Delaware. Let's just make sure it doesn't, upset anybody in Delaware, that, we're not offending their bird. And so I'm so glad we went with that, because it had exactly the intended result that we wanted. And so I hope that you guys got some ideas about authenticity and retail marketing, and I'm open to take any questions you may have.
Hi, Cindy. My name's Scott Rabshnuk from Hill Holiday Advertising. Right here. Okay. I just want to congratulate you on those campaigns. I was actually one of the finalist FE judges. Oh. So I remember both of those campaigns really well, and especially the Blue Hen campaign, which I know you couldn't really elaborate on. We actually called it a perfect FE submission. And that was because, so just lessons for everybody. With FEs, it's not only the idea, but it's the degree of difficulty that you're facing. So you quickly went over that. Yeah. So could you maybe describe just a little bit about how you guys just kind of in that short a time frame really kind of stacked up. What were you going to really kind of focus against? Because you had so many things that you were trying to overcome in terms of what had been handed to you.
Yeah. So, I mean, there were really two things. It doesn't always show up in surveys, but there is just the power of Blue. You know, whether you like it or not, you all know Blue, you trust Blue, it's been there forever, it's stable, it's secure. So we really wanted to remind them, we're the Blue. You know, these other guys, because in these markets, there's not a lot of familiarity with the national players when they come to market. They don't have as much of a brand name. So that was sort of first and foremost. The second thing I want to say is not only are we Blue, we're local. I mean, we have thousands of employees who live in Delaware, who are from Delaware. We are right there for you. We understand you. We understand that healthcare is local and in your region. And then the last thing I'd say was, at least we had the PPO. Now, it may have cost a little bit more, but there were additional benefits to it. And you see we sort of tapped into some of the travel benefits that came along with it. We tapped into the specialist benefits that came along with it. So we really tried to just hone in on some things that people wouldn't be able to get, maybe plant that sort of seeded doubt in their head if they went with the other partner.
Hi. Okay. My name's Alana Elias Corvold, and I run a brand and creative studio at hsastore.com and fsastore.com. And I'm just really curious. These are incredibly impressive campaigns, and I just want to know what the teams look like that worked on all these things simultaneously in short periods of time.
Well, I'll start with Living Proof. I mean, that team, in the end, is probably 70 to 100 people, you know, all in. And the way we're structured, I have a pretty large in-house marketing team. We do some of our own creative in-house. We have an in-house agency. And then, of course, we're working with outside partners on both of these campaigns. So it's everyone from your digital folks to your strategic marketers to insights and research. I mean, it was just across the gamut for us. So it was, yeah, very large collaborative effort. The harder part was the folks outside of marketing, right? Like, I can imagine a lot of you, how do you get, you know, 2 commercials a day through legal? Right? And so trying to get them to also change the way they worked, legal regulatory compliance, so that they were at the table with us so we could figure these things out. The other hard part, especially with Living Proof, was the doctors, right? So it's very hard to go in and be filming, you know, like we had twins just before a kidney transplant, their families are there. I mean, there's all kinds of complications. The families didn't both want to be on screen because there's been some divorce in the families. I mean, like, it's all these things we're trying to do in those moments, and it's like the doctor's got to do their work, and we have to be respectful of that and stay out of their way. And so there was actually a lot of effort from the clinicians to accommodate us and to allow us to get these things done. It was a little bit easier on the Blue Hen side. It was a smaller team. It was largely driven by partners in Napier. I think the hardest part there was actually finding a Blue Hen, because there aren't a lot of them left.
Cindy, can you speak to the media plan for these and how that's evolved? How important, since you know, at least some of those seem to be leading with TV, how important is TV still in the larger media mix? I mean, for the Blue Hen, for the University of Delaware, you were targeting academics who are heavily wired. I mean, you were targeting my wife for that one, and I know that she's not watching TV anymore.
Well, even with Blue Hen, we weren't initially going to do TV. We started to create those simply for digital and for pre-roll, and then we liked them so much, we're like, well, all right, let's go buy some 15s and get them out there and really spread the word. So, so for that one, that was really the...
So they really were built for digital.
Yeah, and then in terms of like how it's changed us, well, so I've been at Highmark Health for 3 years. We weren't a terribly strategic team. We weren't doing a lot of 360-degree and sort of retail-focused marketing when I got there. So some of this really pushed us very fast into that world, and most of our campaigns now live in that world. We've used the tactic like the 30 and 30 a couple more times. So we just completed 365 days of featuring a different woman every day on digital. And we called that AHN Women. And honestly, that wasn't even so much just to keep the social vibe going. That was so I didn't want my team to forget about women and to keep it a priority throughout the year. So I thought, great, forcing a new story every day is going to really keep them on top of things. We ended up at the end on that one turning it into art. We turned it into an art exhibit featuring all 365 women and their quotes, and we took it to our gallery crawl, and it's now on display in our lobby of our company. We take it to the hospitals. Again, it's modular, it transports. But it's really touching. So everybody who sees it resonates. We're also right now are doing a clinical excellence campaign where we chose to do 100 in 100 days. Now only 20 to 30 of those are going to end up being TV executions because machinery is not super exciting. So those were hard ones to do. But the idea that we're going to roll out 100 innovations in 100 days just to prove that we have advanced innovative care, not just high quality care. So we've used that tactic. And yeah, it's a strain overall on the media teams, but we've had really good collaboration and success with the different groups.
Good morning. I'm Frank Carter with Florida Hospital, and love your campaigns. I have a question with regards to the content and being able to sustain that content. You've introduced a new way of communicating. You're building new expectations of consumers on how often you're communicating. Yeah. How are you going to sustain that?
I know. Yeah, so like we did the 30 and 30. The next year we probably did about, I don't know, when it comes to TV, maybe 55 executions. You know, every year you're looking at your budgets and you're like, okay, well, you know, this isn't too worn out. How many more can we keep this up? You know, so we have gotten ourselves into an interesting position. Now, we are not running out of content on the health system side. So the beauty of a health system and research and innovation and customer stories is there. I mean, it's honestly, as a marketer, it's easy. They're differentiated, it's beautiful, it's emotional, it's all the raw material you need. The hard part for us has been on the health insurance side. And we've struggled with the living proof format for Highmark, partially because part of the magic is that the format works when you feel like you're watching something happening. A lot of the stuff that happens in insurance happened 3 months ago. And so how do you turn that into a moment? So some of our most effective stuff was stuff happening in the moment. Somebody having a pharmacist come to their house to review their medication, someone having a home infusion, having the nurse come to their house. And then recently we tried to tweak the format where we had basically our members, our patients, talking to the camera about their care managers and their health coaches, and it didn't work as well. And a part of it is regular people aren't beautiful people. And in this format, that was okay, because you're just watching what's happening. But when you're supposed to be relating to them and they're talking to you, and someone's maybe, you know, very large or very old or very different than you, people didn't really relate. And so we couldn't get engagement when we tested the spots and like how people were watching and reacting emotionally. We couldn't get the engagement we wanted. So we're still, you know, because you got to stay fresh, right? So like you can't just keep doing the same thing. So like we've evolved this 2 or 3 times now in 2 years, right? And so I don't know. We're kind of we're figuring it out as we go.
Figuring it out as we go. Cindy Donohoe, that was fantastic. Thank you so much for sharing that.